Is the camera rolling?
Yeah, the camera's rolling.
Okay. FIP. FIP stands for feline infectious peritonitis. This is a viral infection that comes from a mutation in feline coronavirus, also known as FECV. Most of the feline community has feline coronavirus in their body, and it is typically not hazardous and presents no symptoms, but on a very rare occasion, that coronavirus will mutate into what we know as FIP. Now, I am no professional, but I am a researcher and a person with lots of experience, but it's whatever. Now let's see a real life example, shall we? Ruby, good morning, mamas. This is Ruby, a foster cat I was in charge of since August of 2024. She was only about 3 months young when she started presenting symptoms such as fatigue, dehydration, and most importantly, a bloated belly. In our case, we have never seen such a thing. So, Ruby took a blood test and presented signs of anemia with a low red blood cell count. It is difficult to diagnose FIP due to the range of symptoms from lack of appetite to a thin, frail body, and how there's only a specific test that can just barely differentiate the FECV and FIP strains. There's 2 types of FIP that can be identified. There's the wet, also known as the effusive form, or dry, the non-effusive form. In Ruby's case, she presented a fluid buildup in her abdominal region, which then translates into her having the wet form. As for the dry form of FIP, inflammatory cells accumulate in many organs like the brain, liver, and kidney. According to the VCA Animal Hospital, up to 50% of cats in an American household and 80 to 90% of multi-environmental cats become infected with feline coronavirus at some point in their life. Most cats, about 90%, remain healthy and typically present no symptoms, but less than 1% of the cats with FECV has a strain that then develops and mutates into FIP. Now, genetic factors are thought to contribute to the development of FIP, but what has been confirmed is the disease being transmitted from a fecal to oral route. Now let's figure out how to take care of your feline friend. First, you want to make sure to always provide them comfort and love and always be there for them. They also need warmth in times like these. Make sure your feline friend stays hydrated and frequently take them to your veterinarian to get their blood work checked and to see what type of treatment the veterinarian can give them. You will want to keep up to date with the regular feeding system, such as possibly losing appetite, like in Ruby's case, and you may even have to assist them with their feeding. Now, FIP is an incurable and almost always fatal disease if not treated. There is currently no effective licensed treatment, but your veterinarian may prescribe pain and inflammatory medications to control the FIP. It is recommended to join a support group called FIP Warriors on Facebook, where many other stories are shared pertaining this virus and where you can get help. Now, I have something important to show you. Let's go. This is Snowball. Snowball is a cat that has FIP. Snowball's owner, Jack, knows about the treatment GS-441524 that is not commercially available nor FDA approved. This treatment runs up to $10,000 and is currently only available to felines pertaining in the study of this treatment. Many questions will be asked for the documentation of the feline's process. Then the feline will be on injectable or pill form of GS for 84 days and then will be on observation for another 84 days. Ruby was involved in the study and she's gotten multiple blood work done that proves that she's healthy. Fortunately, after being diagnosed with FIP, Ruby is 100% cured and has lived for another 7 months and is currently on her way for adoption. A reminder that GS is still being studied, and as of today, we still don't know if there's any side effects later in life. It is not recommended to go against a veterinarian's advice. Information should be taken with a grain of salt and should be further looked into. Make sure to always consult with your veterinarian, make sure to always do your own research, and make sure to take precaution when performing anything out of the usual.